Everyone needs nutrition. For hospitalized patients, there is a 50% risk for developing malnutrition during the hospital stay. Without receiving nearly immediate nutrition, patients that are mechanically ventilated in the intensive care unit, that have undergone surgery, children and preterm infants may have a significant worsening in their medical condition or even die. About 27 million feeding tubes will be inserted around the world during 2020. These feeding tubes are routinely placed blindly via the nose and then via the stomach to the small intestine, the location where nutrients are absorbed by the body. These blind placements lead to the fact that over 1 million feeding tubes are accidentally placed in the lungs. If the tube enters the lung, there is a possibility that the feeding tube will cause a collapsed lung, which could lead to death. Sometimes a feeding tube is left in the lung, filling the lung with liquid nutrients, which can also cause death or prolonged hospitalization. The ENvue electromagnetic navigation system and feeding tube assists clinicians to quickly and safely place feeding tubes in the stomach or small intestine. ENvue is the only navigation device for feeding tubes that creates a personalized map of the patient's body. It provides a clinician with steering directions, which prevent the feeding tube from entering the lung and allow it to be positioned well within the small intestine. ENvue is 510(k) FDA cleared and commercially available in the United States. Multiple hospitals are already using the ENvue system and feeding tubes on a regular basis, with thousands of successful feeding tube placements. These results are supported by a successful multi-center clinical trial that clearly demonstrated the accuracy and safety of the navigation system. Together with a strong intellectual property portfolio, a promising pipeline of products, and a highly experienced management team, ENvue is truly on the way to becoming the new gold standard for feeding tube placements. Thank you for watching.